All right, welcome back to ABA exam review and the continuation of our BCBA practice exam series. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe, like, and share. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst is supervising a technician who is working with a nonverbal client in a home setting. The technician gets frustrated at one point and says, "This would be so much easier if they could talk." It was unclear whether the parents heard the comment or not. How should the analyst respond? All right, so this question is related to personnel management, to supervision, and to ethics. First, we're always trying to maintain the dignity of our clients. So by saying something like, "This would be easier if they could talk," even if it's just a heat of the moment comment, is not respecting the client because that is just putting them at a level below someone who can communicate. On top of that, we don't know if the parents heard the comment or not. Let's assume they did. Well, letting that comment go is going to reflect poorly on you and the profession of ABA. So if you're in this situation, how should you respond as the supervisor? A, wait until after the session to address this comment about the client. There are times where you may want to wait to have a one-on-one debrief with your technician, but in this case, if you think the parents may have heard this comment, you don't want to leave it hanging without addressing it. Again, it could reflect poorly on you and ABA as a profession. B, ignore the comment to avoid reinforcing this behavior. We cannot ignore this comment. It is not ethical. It is not providing the client with dignity. C, address the comment immediately. Yes, you need to do it in a professional manner, but this comment has to be taken care of on the spot. D, adjust a behavior plan to increase effectiveness. Well, that's not related to the comment. That's neither here nor there. Your focus right now is remaining with this technician or teaching this technician or informing this technician of why what they said is not appropriate in the context of this situation. You need to address this comment immediately so that the comment does not reflect poorly on you or the profession of ABA. And so we remain giving the client the dignity they deserve. A behavior technician starts implementing a punishment-based procedure that was not approved by her supervising behavior analyst. This has been going on for nearly 3 weeks at this point. Who is at fault for the punishment intervention? This is a good teaching/reminder question of your role as a supervisor. If you're supervising someone, if you have the responsibility of a technician or a team of technicians, everything they do falls under you, especially if they are your supervisees on the official BACB website. So if you have a situation where a technician is implementing punishment and it wasn't approved, well, whose fault is that? A, the technician for implementing without approval. Yes, they're not doing what they're supposed to be doing. They are at fault. But it is also the supervisor's fault for letting it go on this long. 3 weeks of punishment-based procedures without any sort of supervision or check-in is just not acceptable. Going 3 weeks without knowing what is going on your case is not acceptable at all. And then C, the stakeholder for not reporting the intervention. It's not the stakeholder's job to pick and choose or understand what we're using. It's the technician's fault for using punishment or using a procedure without approval, but it's really the supervisor's fault for even letting it get to this point. So who's at fault? Both A and B. A marketing team wants to determine the optimal number of advertisements needed to significantly increase product sales. They test the impact of displaying 3, 5, and 7 advertisements per day. Which type of analysis is being conducted? Let's think about our different analyses: comparative, parametric, and component. Because functional, we're just trying to identify the function of behavior. We're not looking for a function here. Let's think about a comparative analysis. Comparative analysis, we are comparing interventions. Component, we are comparing interventions that are part of the same package. Parametric, we are taking one intervention and we want to know how much. How much of this intervention do we need? So if we're using advertisement and we're deciding if we need 3, 5, or 7, well, what type of analysis is that going to be? That would be a parametric analysis. There are 3 coffee machines with spouts lined up at a breakfast counter. When you open the spout, coffee comes out into a cup. 2 of the spouts have plastic cups covering the spout so they cannot be opened. The plastic cups are functioning as a blank relative to getting coffee from those machines. So the question is asking about the plastic cups and relative to getting coffee. What do we know about getting coffee from the machines? Well, we have 3 machines lined up. When you open a spout, coffee comes up. Coffee comes out. So when you see that spout, what is it signaling to you? It's saying reinforcement is available if you open the spout in the form of coffee. But if we have plastic cups covering the spouts, what are those plastic cups saying to you? They're telling you reinforcement is not available because you can't use these spouts. So what do we call it when a stimulus signals that reinforcement is not available? A, an establishing operation. With an establishing operation is going to increase the value of a consequence. It's a motivating operation. We're not worried about value of getting coffee here. We're worried about the ability to get coffee. And so the plastic cups are not functioning as an SD for getting coffee. They're not signaling to you coffee is available. They're functioning as a stimulus delta. They're saying coffee is not available. A stimulus delta signals that reinforcement or punishment aren't available. And then, of course, an abolishing operation suffers from the same problem as an establishing operation, whereas we're not dealing with the motivating operation here. The plastic cups are functioning as a stimulus delta relative to getting coffee from those machines. You are referred a client with a dual diagnosis of autism and ADHD. You're fairly new to the field and your expertise is in autism, but you want to take on the client. What should you do to make sure you are providing ethical services? So another ethics question, and we want to provide ethical services. Well, what is the situation? The situation is you get a client, they have autism and ADHD. You are an expert in autism, but you want to take on the client. And why is that an issue? Well, they have the second diagnosis of ADHD. Now, in modern behavior analysis, if you work with children with disabilities, you're going to have many, many, many children with dual diagnoses. It is not realistic to take a child who has a dual diagnosis and not accept them because of the dual diagnoses, unless that is the focus. But you can still focus on the behavior here, knowing you're an expert in autism. But we want to know what to do about the ADHD. How should we remain ethical? A, conduct a functional behavior assessment on the ADHD. Well, we're never going to assess the condition or the diagnosis. That's not our job. So A does not fit into what our role is as behavior analyst. B, seek consultation or peer-reviewed journals regarding ADHD and behavior management. Absolutely. Continue your education. Seek out competence. Seek out mentorship. It is your job to train yourself and teach yourself and better yourself on things you don't know that are relevant to our clients. C, refer the client out so that you are not practicing something you do not know. This is not a reason enough to refer the client out. You can still address things with this client that you are competent in. You don't pick and choose your clients based on things like this, right? Now, you're going to go through an assessment and then make that determination. But just because they have the autism and ADHD does not mean you need to refer that client out. D, find old treatment plans for clients with ADHD and use those interventions that worked. Well, we know we never plagiarize our own interventions or anyone else's. So D is not ethical. What you want to do is better yourself. Understand what you don't know, become more competent by finding mentors, by reading journals, by doing your homework and getting better as an analyst. A researcher is conducting a study in a public school and wants to publish the findings. He plans to include specific details about students' behaviors and responses to interventions. What steps should the researcher take to ensure compliance with confidentiality requirements? When we talk about confidentiality, that of course means privacy, it means HIPAA, it means company policies, and we're always protecting our stakeholder and client privacy at all times. That is a huge responsibility of ours. If there's a researcher who's conducting a study in a public school and he wants to publish those findings, what should he do? Because he wants to include specific details about behaviors and responses. What steps can that researcher take to make sure we are remaining confidential? A, omit the student's name in the final publication. He can certainly do that. That is very important, right? He should not be sharing public information like names about his students. So A looks good. Is there a better answer? B, obtain assent and consent where necessary and omit personal information. Even better. Now we have assent, we have consent, and we are omitting personal information. B is much better than A. It's stronger. C, avoid sharing the presentation at conferences. Well, we want to disseminate knowledge. We want to share knowledge about the field. So he can share it. He just needs to be in compliance. And D, only share the data with people who know the student. No, not necessarily. If he can take steps necessary to remain confidential, then it's good to share our findings with others in the field. Hannibal will scratch himself when denied access to his iPad at night. Hannibal's behavior analyst wants to use an experimental design to target this harmful behavior. What design will be least appropriate to use? Don't overthink this question, right? What design is going to be least appropriate for scratching himself? It's a harmful behavior where Hannibal scratches himself. Well, alternating treatment is going to be okay, right? Because we don't even need a baseline with alternating treatment. We can just jump right in. So alternating treatment would be okay. What about an ABA design? Well, an ABA design, we're going to have a baseline, an intervention condition, and then we have to go back to baseline. So what if the intervention is effective? Do we really want to take the chance that Hannibal is going to start scratching himself again by withdrawing an intervention? That does not seem very ethical. So the ABA withdrawal design is going to be the least appropriate if it brings the client into potential danger. Which of the following would most be considered an explanatory fiction? With mentalisms, we have hypothetical constructs, explanatory fictions, and circular reasoning. Hypothetical constructs are things like ego, where we are creating an idea that we can't really measure, we can't really observe. An explanatory fiction is when we take that construct and use it to explain why behavior happened. Circular reasoning is when we use the cause and effect interchangeably. So if we say Dave is tired, that is not an explanatory fiction because we're not using the fact that Dave is tired to explain anything. B, Dave does not complete his work because he is tired. Now we are taking this idea of tired and using it to explain away work. We haven't defined tired. We haven't measured tired. We're just saying Dave is in a state of being tired, and that's why he's not doing his work. That is an explanatory fiction. C, Dave is always tired because of his work, but Dave's work makes him tired. This is circular reasoning. Well, Dave works, so he's tired. Why is Dave always tired? He works. Goes circle, circle, circle. Is C related to an explanatory fiction? Sure, but we would call that circular reasoning. We would call B an explanatory fiction. Lainey usually cooks breakfast for her family in the morning, which they love. However, Lainey, when in a rush, will leave the stove on, which is a fire hazard. What type of intervention would be best for Lainey's behavior? So we're looking at Lainey's behavior. And what is Lainey doing? Because we want to pick an intervention that's going to be best for the behavior. Well, she cooks breakfast. Great. But she leaves the stove on, which is a fire hazard. Now, we need to get rid of that behavior quickly, right? And so we're going to use a differential reinforcement. What is wrong with the differential reinforcement of alternative behaviors? The problem with the DRA is when we teach a replacement behavior using DRA, that replacement can happen at the same time as the target. We need to eliminate leaving the stove on. We don't want that to happen. A DRA allows that behavior to continue to happen, even though we're not reinforcing it. We're teaching a replacement behavior that can occur simultaneously. A better option is going to be the DRI, where we teach a replacement behavior that is completely different from leaving the stove on, whereas the stove cannot be on and the replacement behavior can happen at the same time. It's not possible. DRI is going to be better given that it's a fire hazard. DRL and DRD systematically reduce rates of behavior and lower behavior, but this is a serious hazard. We want to get rid of it much more quickly. We don't want to systematically, step by step, reduce it. So the intervention that's best is going to be our DRI. Not only are we reducing it, we're also doing it hopefully quickly and teaching a replacement so that the behavior does not come back. Family that you work with is moving out of state in 2 weeks. The family has begun the process of enrolling an ABA with another provider in their new state. As the current analyst, what is your obligation? If you're an analyst and you have a situation where your family moves and they're going to another ABA provider, what is your first thought? My first thought is collaboration. How can we help? So what is your obligation? A, discontinue services promptly and responsibly. We don't need to discontinue services promptly. We need to be systematic about that and smart about that. There's 2 weeks left. Can we do services for 2 more weeks? B, offer to assist with the transition process, even if it is not related to direct services. Now, think about that. Your job is not the transition process if it's not related to your services. Your job is to help the new ABA company, however you can, by C, contacting that company and providing them with treatment plans or other relevant history, but just helping with the transition process is not your job. You need to stick to your competencies, which is behavior analysis, collaboration with other professionals, and sharing treatment plans. Other things that go on in the transition process aren't necessarily your responsibility. All right, thanks for watching. Check out behavioranalyststudy.com for all of our study materials. Be sure to subscribe. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.